Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got a great lesson for you on how to use your back muscles during the squat to help improve your degenerative disc disease. Hope you enjoy. So today we're going to be going over using your multifidus muscle and your long thoracic erector spinae muscles to maintain the normal arch or lordosis, the curve in your lower back, to prevent the negative effects of bending forward from the waist and the lower back on degenerative or herniated discs. Many people with those disc problems have problems when they slump, when they bend forward. It produces excess pressure on the front of our disc and opens up the back of our disc. That winds up aggravating our disc conditions, both in static positions like standing and walking, as well as sitting, and also during movements like working out and exercising. So these two muscles are going to be used to train endurance, or their holding ability over time, to strengthen our ability to maintain that lordosis and decrease the chances of flexing forward during static postures and activities. So the multifidus first. If you take your thumbs and go to the midline of your lower back, those bony knobs known as the spinous processes, pick any knob you want in your lower back and go to the very bottom of it. With both thumbs at the bottom, move out slightly, maybe 1/8 of an inch to the side, so you're at the lower outer corners of those bony knobs. That's what the multifidus muscles are. And if you feel up and down on each of those knobs in your lower back, there are 5 of them, right and left, you may feel one of those areas has a hollow to it, which means the multifidus muscle is not as large there, it's atrophied over time, many times due to lower back pain. If you can pull your lower abdomen in, that's between your belly button and your pubic bone, if you pull that lower abdomen in, you normally should feel those multifidi muscles bulge out into your thumbs as you hold them on the outer lower tips of each of those bony knobs, the spinous processes in your lower back. If as you pull your lower abdomen in, you don't feel the multifidus muscles bulge out at one or more locations, either on the right or left side, I want you to practice targeting that pressure of your lower abdomen pulling in into that area that you feel not bulging out. Just try to imagine that that pressure of the lower abdomen winds up at that area that feels hollow or is not bulging out. And you'll begin to feel many times that multifidus muscle engage and start to bulge out. We have other videos on multifidus training. If that technique doesn't work, there are other techniques, but that's out of the scope of this particular video. Once we get the multifidus set, we're going to leave one hand on that area where you have a weak multifidus to make sure that that is still bulging out, and take the other hand and place it about 1 inch to the side of the midline of your spine. That's going to be the erector spinae, the longissimus and the iliocostalis, a little bit more to the side, that runs from your pelvis all the way up to your mid-back and your ribs and your vertebrae in your mid-back. That's the second stabilizing muscle we're going to monitor with this. So once we have our thumbs in each of those muscles, we're going to use a parallel stance where our feet are facing straight forward and are placed directly underneath the center of our thighs and knees. And we're going to hinge forward, allowing our entire upper body to rotate forward from our hip joint, not our low back. Remember, we're trying to resist the tendency to flex forward from the lower back. So we're going to bend forward from the hip joint. So that curve in my lower back, whatever that normal neutral spine curve is, again, we have other videos on neutral spine, but if you have your tail under or tail up, that amount of curvature is going to be the most pain-free for you. If you go up a certain amount and you have pain, you're going to stop at that segment of motion and you're going to go under with your tail the opposite direction. If you have pain, you're going to stop at that segment of motion and you're going to place that pelvic tilt or that tail up, tail under directly between those two extremes that cause discomfort. That's your neutral spine from a posterior and anterior pelvic tilt position. There are other factors that go into neutral spine. Again, we have other videos. You can either go to the Posture Size of Pain-Free websites, get a free body analysis, learn how to hold all your other dynamic, global, and local muscles and posture to maintain a good neutral spine. But being that you have a neutral spine, you've placed your spine tail up or tail under and those other factors in a position that doesn't hurt, meaning the safest zone of your low back position, with your multifidus engaged on those weak areas and your other thumb maintaining pressure on those erector spinae muscles on one side, I want you to bend forward from the hip joint, the ball and socket, so your whole body is pitched forward, your hips and your knees bend. In this position, we want to maintain that multifidus contraction. We want to make sure our lower tummy is pulling in, causing that bulging out, and we're just going to isometrically hold that position. With our other finger on that erector spinae, remember that's about an inch to the side of your spine, you can increase that tension by tensing your chest slightly upwards. Now watch, I'm not actually moving my chest up. That would increase the arch of my back. I'm just tensing it upwards, as if I'm trying to elevate it. And as I elevate my chest a little bit, you'll feel more tension on that muscle, the erector spinae, longissimus, and to the side, the iliacostalis, that are located about an inch away from the midline of your spine. And you're going to maintain those tensions from the beginning of about 5 to 10 seconds, and then squeeze your buttocks together and come up. Over time, you can hold that position and deeper levels of that position for greater and longer times, and this increases the strength of your extensor mechanism, also known as your posterior chain. Your buttocks, hamstrings, lower back muscles are all contracting in unison, so you have an integrated relationship between the thorax of your body all the way down through your legs, and those extensor muscles are working as a unit, particularly the multifidus and the long extensors of your mid-back, to hold that neutral spine, to make sure you're holding that lordosis. That gives you the ability to now have the strength and the endurance and the coordination to maintain those corrections as you're down, reaching for things, bending over to pick something up. If you need to reach down for exercise and hold a horizontal position like a horizontal squat, or if you're doing a row at the gym, this starts to train your muscles to better prepare your lumbar spine, to decrease flexing forward and avoid aggravating your degenerative discs. If you like this video and would like to help me share it with others, give me a thumbs up below. Want more information about degenerative disc healing exercises? Feel free to subscribe to our channel. We also have a great exercise program for degenerative disc, which teaches your analysis for the lower back, pain relief exercises, conditioning and healing exercises, all at the painfreeandfit.com website. That's the fast track program for degenerative disc disease. I hope that this exercise of isometric squatting that you can build up from seconds all the way to minutes improves your ability to maintain a neutral spine, strengthening your extensor mechanism, and avoiding the deleterious effects of flexing forward on your lower back discs.